and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair and bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be avoided and much of the hair loss can be controlled and can be fixed by managing to modify our faulty lifestyle. Today we have with us Dr. Parul Singh is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD in Dermatology, Venereology and Leprosy. She is currently practicing as medical and aesthetic dermatologist at Chloé Clinique, Kalkaji, New Delhi. Dr. Parul has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient and concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Parul has also written various chapters for CBSE publication in Book of Clinic Dermatologist and has a multiple publication to her credits. She is also a member of prestigious Indian Association of Dermatologists, Venereologists and Leprologists, also known as IADVL. Dr. Parul is aware of the need for the patient awareness and education about hair care and spending a lot of time in giving talks at various platforms across the country. Thank you, Dr. Parul, for joining us today and sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you so much, Mona, for the elaborate explanation and description of my profile. Thank you.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, today we are going to discuss about hair care in current scenario. So, whenever we talk about hair care in current scenario, the most common problem is the hair loss, which is now faced by all of us, irrespective of gender, age, or anything. So, can you please enlighten us today that about hair loss, what's normal and when to be concerned for?
Okay. So hair, like every other, hair also needs rejuvenation. Hair also needs to shed itself and to sort of regrow every now and then. So it is a normal cycle for it to shed and to regrow on its own. This is the normal hair cycle that we have. And if anybody is losing between 50 to 100 hair, up to 100 hair per day is considered to be normal. But if you see a sudden surge in your hair fall, if you see a sudden change in the pattern of the hair fall that you generally used to have, then it might be a cause of concern, and you might just see your dermatologist for that. Mona, I lost your voice.
Yeah. So, Doctor, when you have told us that when to be concerned for, but what are the general causes of hair loss? Why we face hair loss?
Okay, so there are hair loss can be multifactorial. It is an end organ. It can result due to multiple factors. One such very common factors these days is nutritional deficiency. A lot of us are deficient in many nutrients such as B12, vitamin D. Indian population, specifically females, they are very deficient in B12, iron, vitamin D. These are the nutritions which are commonly very deficient in most of the Indian population. But there are other factors as well. There could be mental stress. There could be physical stress. There could be biological stress, wherein the body has undergone some biological stress, such as a long-standing illness, acute illness, COVID, typhoid, dengue. All these things can have an impact on your hair. It may not start immediately when you're having that active disease, but it may present later, 1 month later, 2 months later. Up to 6 months it can present. So these are also one of those factors. Then there could be hormonal influence, PCOS, thyroid. These are very commonly associated with hair fall. So it could be genetic also, it could be hereditary also, it could be influenced by the kind of diet that we are taking. All these have a very big impact in the kind of hair fall that we are having. So it is a multifactorial thing, has a lot of impact because of the lifestyle that we are into. So one has to rule out, looking at the patient, knowing the history. A lot of things are involved in this.
So Doctor, like as you mentioned lifestyle, so nowadays we all are having bad lifestyle, like working late hours and eating not good. So can you please enlighten us a little more about, can a person lifestyle also play a role in hair loss?
So when we talk about lifestyle, it is about the physical and the mental stress that we are undergoing. Primarily these two things. So physical stress could be because you are not taking adequate rest. Physical stress could be because your sleeping pattern is not that great. You are sleeping at odd hours, sleeping for less time, sleeping for a lot of long hours, but at very erratic timings. All of these do have an impact on our overall health, be it skin, be it the hair. Similarly, these hormones also do have an impact, like I mentioned earlier. So lifestyle can make these changes in your hormonal balance as well. So there is a hormonal imbalance with these lifestyle changes that we have, and that's how we present with the hormonal issues. They then trigger the hair loss. It's a vicious cycle. So if you have a good lifestyle, healthy lifestyle, wherein you are getting up on time, sleeping on time, taking adequate rest, giving yourself, your body is exercising well, walking well, there is a adequate physical activity that you're giving, as well as having a balanced diet. Nowadays, people are either crash dieting, overeating, or not overeating per se, but they're not eating right. So that is also very important, that what you're eating on time and eating the right amount of calories or right amount of nutrition that you require each day. That also plays a huge role. And if you make these small changes, they do have an impact on your hair. Like for instance, most of the patients who are given these nutritional support, they show very drastic response in the hair loss that they were having. It's only because the lifestyle was such, only because they were eating whatever was available, whatever was convenient. So that also has a huge role to play.
So lifestyle is actually important for even hair health.
Yes, absolutely.
Just hair. Yeah. So doctor, like now that we know why do we have hair loss, so what are the, like, can you please let us know that what are the medical treatment options available for hair loss, like topical or surgical or non-surgical, or oral is also there, that like we can eat and manage our hair loss?
Yes, absolutely. So nowadays we have a number of options. So looking at the condition of the patient, the doctor would be able to decide whether to go for just topicals or oral medication is required, or we want to top it up with some top-ups, some procedures. I'll tell you about each one of them. So as far as topicals are concerned, we do have the peptides. There are peptides that we can offer to the patient. Then there are peptides are basically nutritional support, or peptides are basically support that we can give to the hair shaft, hair root directly by application. Then we have drugs that we can offer them topically. Then the second thing that we have is the oral medication. Oral medication, we have a number of drugs that have shown to be showing good results as far as the hair regrowth is concerned. Then the third thing is that we can offer the patient multiple procedures that we can go. These procedures could be PRP, these could be meso drugs that we can infuse while doing the procedures. These could be doing threads. These could be doing, ultimately, if the patient is not responding to any of these topicals, orals, as well as, not responding to the procedures as well, one can opt for hair transplant ultimately.
Okay, so if nothing works, then we can have a hair transplant, and it is successful that we can get the hair back.
And also, it's very important to mention here that even if you have hair transplant, you need to support your hair follicle that has been transplanted from one area to the other area with these peptides, with these topical minoxidils, which are going to prevent further hair loss. Because if you have lost your hair follicle once, you are susceptible to lose them again and again. So it's very important to sort of maintain it.
Okay, so even after transplant, we should, follow the medications.
Yes. Because if you've lost it once, if your hair follicle has you've lost your hair follicle once, you may lose it again. After all, your own hair follicle from one region has been transferred to another region. So those influences can be on that particular hair follicle as well. So it's very important to identify the root cause, identify the deficit that you have, be it hormonal, be it nutritional or the lifestyle. You need to rectify that, and you need to take the adequate treatment suggested by your dermatologist.
Okay, very informative, doctor. So, doctor, there is one word called nutraceutical, which is like getting a lot of focus nowadays. So, can you please explain us what is nutraceutical and what is the role of nutraceuticals in hair health?
So basically what is happening nowadays, that once we spoke about lifestyle, because of our lifestyle, because we are busy, because we are caught up with a lot of things, we are not able to take the nutrition, the right amount of nutrition that is required by our hair per se. Lot of times, sometimes in fact, what happens is that you are taking the particular nutrient and it is not being absorbed. There's a malabsorption of the nutrient which is particularly required for your hair. So in those cases wherein there is a deficit in the nutrition which is required by your hair to regrow, to not shed so much, you need to have a support. And these are the nutrients that you can take as an oral pill every day, or there are some suspension options are also there that you can drink probably with your water, milk, etc.
Okay, so these nutraceuticals are something which
basically supplements that are going to fortify you with all the vitamins that you essentially require for your hair.
Yeah, we are not taking in a diet.
Yes.
So, like you said, vitamins. So, what are some of the vitamins used in management of hair loss, or we can say alopecia?
So like I mentioned earlier also, that three things which are very, very important are vitamin B12, vitamin D, iron, biotin. These are the nutrients which are very commonly found to be deficit in most of the patients, especially in India. So these are some of these nutrients that are very, very important.
So, doctor, like earlier you said that zinc, iron, copper. So, minerals like zinc, iron, copper, do they promote hair growth, or it is just for the health, like supplement?
It is a supplement. Everything is interconnected. So basically, they are going to fortify the hair health, and that is how you're going to have healthier hair. You're not going to have hair loss. You're going to have a good amount of good volume of hair, and they're going to be healthy. They are the supplements that you require for your hair.
Okay, so if the overall supplements are balanced, and we can have a good hair growth.
Absolutely. They're all interconnected, right? If you have a good hair health, obviously you are going to have better hair regrowth. Your hair cycle is going to be quite healthy. You are going to lose hair. That is normal for us to lose hair, but there is going to be adequate regeneration as well. Once we don't have these vital minerals that are required by us, that is where the problem is.
Okay, so doctor, like on internet, there are so many like supplements are available. So is it okay to take these supplements like blindly, or is it required to take these nutrients as per gender RDA requirement?
Absolutely. You need to know what exactly the deficit is, whether or not you require it. It is absolute. You're not a guinea pig. I tell all my patients this, that you're not a guinea pig. You can't just pop the pills and have them for 1 month or so and decide for yourself if it's working for me, if it's not working for me. You can't do that to yourself. Sometimes it can be dangerous as well. And why do that to yourself when there are experts out there who can help you out with the right amount of nutrients, with the right amount of prescription, and with the right amount of drug? They will be able to help you out. So I don't think it is absolutely advisable to pop anything on your own. And requirements also, male and female, they do have different requirements. So it is best for your dermatologist to judge what your requirements are and prescribe you accordingly.
So instead of following just blindly on the internet, we should visit to the doctor and get our treatment plan ready.
Absolutely.
So, doctor, like you said earlier, also you mentioned stress. So, stress is something which is unavoidable nowadays. So, can you please explain us what is the impact of stress on our hair health?
So basically, stress is something which is very underrated, especially in India. Psychological health, stress, all these things are very, very underrated. People do not address it. People do not acknowledge it. They do not realize while they are in physical or mental stress that this can also have an impact on my skin, my body, my hair. So this is something which is most ignored. But these are lot of times one of those trigger factors that are there as far as your hair health is concerned. So something that should be taken up by yourself first. You need to understand that that it needs. So it should not go in a physical or a mental or a biological stress in any way. So stress is something which will trigger more and more hair fall. So that is something that you need to definitely look out for.
Okay, so it is important for us to, manage things. Yeah. Okay. So, doctor, like when we are at home and we are under stress and like working late night, our mothers like घर में मम्मियाँ बोलती हैं कि आप लोग ऑयल लगा लो, मसाज कर लो और भर भर के ऑयल लगा लो ताकि बाल भी अच्छे ग्रो करेंगे, शाइन करेंगे. So, like, is it true like oiling hair is a ban or a boon?
So the thing is that oiling your scalp or hair, I'll discuss the two separately. Oiling is basically relaxing. Blood circulation, and that is just about it. Hair shaft would not be penetrated. It is a big molecule to sort of penetrate into your shaft and give it that that nutrition or the or the moisture or the hydration that you're thinking that it would give and would last. It would not happen. So we need to identify that first, that it is just going to, with oiling, if I oil my scalp, if I do it with the oil, I'm just going to massage and increase the microcirculation there. It's not bad. You can do that. But understanding here is very important, that if you are going to oil your hair so much with so much of oil, in the process of shampooing your hair, you will strip off the natural lipids of your hair. Right? So it will strip away the hydration that it already has. So आपके hair तो और dry हो गए. In the process of oiling, आपने इतना ज़्यादा oil लगा लिया कि जब आपने उसको wash किया तो natural oil भी strip away हो गया. So oiling is okay. Do not keep it for very long, because in long hours, if you're putting that much of oil on your scalp or head, it will attract dirt. It will affect my roots. वो root में ही जाएगा और dirt से root और weak होगी. You will sort of invite more trouble than any benefit for yourself. If you want to oil at all, maybe do it 20 minutes before washing your head. half an hour, 20 minutes is more than sufficient for your relaxation, for your microcirculation, all of that. 20 minutes to 30 minutes prior to washing your hair is more than sufficient. After that, please gently wash it off. That is more advisable. It has no role in hair growth.
Yeah. Okay. So for relaxation and conditioning, we can do the oiling, but it has no role in hair growth. So, doctor, can you also please give us some important tips for healthy hair?
Okay, so as far as important tips are concerned, it is a process that you need to. It is something that you need to practice every day. If not every day, this has to be a lifestyle around your hair that I would want you to follow if you're not having any specific condition. Firstly, you need to have a balanced diet. You need to have adequate rest. Then, secondly, and very, very importantly, your diet has to be full of nutrition that are essential for your hair. Then use a mild shampoo. Don't go for very harsh shampoos. Condition it. It is not bad to put your conditioner. It is not bad to put mask every time you shampoo. It is not bad to put those serums afterwards. They're just going to coat your hair with a little bit of silicone, with a little bit of moisturization. And remember, it is not going to have a long lasting effect. It will wash off with your next shampoo. Also, it is very important to know here that the results with your hairstyling, with your ironing, with your curls, all of that looks very nice, but try and keep it minimal, as less as possible. Those salon treatments are also something that you should minimize as much as possible. Do them only when required. Hair spas are okay, but they will also last you for a couple of shampoos. Go for balanced diet. Go for managing the kind of hair that you have. You should and try and know the right kind of styling that you should do with the minimal chemicals. Like if you have curly hair, try and tame them with a lot of products around your hair quality, around your hair structure, around your face, rather than just straight away opting for only straightenings. And as I have said, that anything in excess can be a problem. That is definitely there with your hair as well. A lot of ironing, a lot of dryers, a lot of curlers, they can be a problem. Then regularly you can get them trimmed. Use a cleansing shampoo to your scalp every now and then if required, if you're building up too much of oil. Then otherwise shampoo should be normal. It should be mild. Definitely, if you have long hair, you should identify that shampooing is basically for your scalp and the shaft of the hair has to follow. You don't have to vigorously shampoo the whole shaft every time. And conditioning and taming it with your mask and everything is very important. I think that is pretty much which covers the normal, regular, general care around your hair. Minimize gels and those products that you use for your hair styling, especially as far as the guys are concerned. They use a lot of sprays, styling mousse, gels. They should be minimized.
Okay, doctor. Very informative, doctor. Can we take some live questions now from the audience?
Yes, please.
Yeah. So, okay, first question from our live audience is, doctor, I have androgenic alopecia and doctor have prescribed me some vitamins tablets. So do I need to take these tablets for my whole life or it can be stopped?
Okay, so by what you've told me, I understand that he has been given some nutraceuticals, which are nutritional support. So once your nutritional support sort of balances, which would take 3 to 6 months easily. Once that balances, then you can be guided about your balanced, healthy diet, and you can focus on that. You don't have to take the nutritional support forever.
Okay. So he can stop when the nutrition support is well balanced.
But only when his doctor says so.
Yeah. Yes, not to do by himself. Yeah.
A lot of times what happens is that we consume it for 2 months and the hair fall starts to show, just show some results in terms of hair fall is less. And you stop to take those medications. I tell my patients this, that the glass was empty. Just when it got half filled, you stopped. It will come back because your lifestyle was such and you did not address it properly. You stopped on your own in the middle of nowhere. It will come back. Right? So you need to maybe fill that glass entirely. And then when your doctor says that, okay, now the nutritional support is adequate enough and you can take these many things in your diet, then you're good to go.
Okay. Okay, very informative, doctor. Okay, another question from our audience is, hi, doctor. Someone told me that home remedies like lemon and onion juice can let my hair grow back. I have a bald, patchy hair. So what should I do? Should I use these home remedies?
It's a big a lot of patients come with contact dermatitis, which is that the lemon or the home remedy that they have tried has caused irritation, has caused dryness, redness, and all of those things. You, like I've said earlier also, you're not a guinea pig. Why should you try anything on your own? Let your doctor decide. It's just a visit away. Please let your doctor decide the pattern of hair loss, the extent of hair loss. Says a lot about your hair pattern of your hair loss. Let the doctor decide how and what to give you. Onions and lemons would definitely not be able to help you for sure.
So instead of like not knowing the condition and just applying it is not right.
No, not at all. It's not going to fetch you anything. You're going to irritate your scalp, and in the process, what will happen is that once you'll see your dermatologist and they prescribe you any peptides or any minoxidil or anything to apply, that will also irritate you because you've already irritated your skin there. The scalp of the skin of the scalp is already irritated because of these lemons and onions and all of those things. They will further make it more sensitive. Your skin will become more sensitive. So आप अपनी situation को complicate कर रहे हो rather than solving it.
Very interesting, doctor. Another question from our viewer is, doctor, my wife keep pulling her hair while she's stressed, and now she has pulled her hair so much that she's having severe hair loss. So is it because of the stress or she has some other problems?
This could be multifactorial. And definitely you have to see your doctor. You have to see the doctor as soon as you can. It could definitely have a major role to play because of the stress. And it will be advised very well by your doctor. You will see the results are going to be very good in terms of her mental health, in terms of her physical appearance of the hair. But seeking a dermatologist's opinion is very important in this case. Should not be neglected.
And the question from our viewer is, doctor, I have a dry scalp and someone told me I should apply oil. So, and you suggest that we should apply oil in a less quantity only. So what is right for a dry scalp? Can you please give some suggestion?
Okay, so dryness, when we say dry scalp, could be because of many reasons. Sometimes there is dandruff, what we call, could be seborrheic dermatitis. Sometimes there is actually the skin of the scalp has become very irritated, very sensitive because of certain things we've applied or naturally also. So it is best to investigate into this, best to, see a doctor once your dermatologist visualizes it and identifies what your exact issue is. Only then you should be prescribed it. I would definitely recommend you not to apply anything on your own, neither lemons nor those oil based treatments also. It might just make it more sensitive, like I mentioned.
Another question from our audience is, doctor, I'm 25 years old, female, and I have been losing hair from the frontal part of the head, and someone told me that it is a sign of alopecia. So can a female also have alopecia, and should I visit to the doctor?
Absolutely. You should. Absolutely, you should. Yes, females can also have alopecia. Female patterned hair loss is very, very common. And it could be due to hormonal changes. It could be because of your lifestyle, because of the nutritional deficiency, all those things that we've talked about. These are subtle signs that our body shows sometimes. So there could be internal factors. It is best to take the doctor's advice.
Okay, so alopecia can be like found in both.
Definitely. Basically, whenever there is a hair fall, this I forgot to mention earlier also, it could be a subtle sign of some underlying disease as well. A lot of my patients who are coming with just hair loss and I'm getting them investigated come deficit in so many nutrients and they have thyroid or they have PCOS. So these are subtle signs that our body shows. Could be hormonal as well, right? So PCOS and thyroid are two things that are very well identified with the hair loss.
Interesting, doctor. Another question from a viewer is, doctor, recently I have gone through a blood profile testing and I found that my iron levels are fine, but my B12 is extremely low, and I have started B12 medication, but I am also having a hair loss. So is it because of that, and should I visit to a dermatologist or should I take only these tablets?
When you are having your nutritional support, so nothing to worry as far as the is concerned, but definitely size is always important. Sometimes it may happen that you not just B12 deficit, there is something else as well. For to identify. So go and am I audible?
Yes, doctor. Little lag is there. Little lagging is there. Uh, doctor, there is a little connection problem.
Mm-hmm.
Can you just off your camera and then you can reconnect the camera? Doctor, are you there? Yeah, hi, doctor.
Am I?
Yes, doctor. I'm not able to see. Okay, now I can see you. I think, doctor, there is some network issue from your side. So can we? Yeah, doctor. So can we connect from like I think you're using Wi-Fi. You can also try with your mobile data if it is possible. Or you can do one thing, doctor. We can turn off our camera and then we can continue our discussion, and then we can answer a few questions for our audience.
Yes.
And yeah. So
Yes, we can do that.
yeah. So no problem, doctor. Another question from our viewers is that, doctor, what is the yeah, what is the secret behind your glow and healthy hair?
First of all, genetics. Second, I try to maintain a healthy lifestyle as much as possible. I try to sleep on time. I try to get up on time. I do try to take dietary supplements. Sometimes I do take the nutraceutical support as well. And yes, that is about it. I make it a point that I am removing every makeup or the sunscreen and applying my night and day routine very, very religiously. So consistency basically is the key here.
Okay, so you follow a healthy lifestyle. That's the secret. So, Doctor, another viewer from our audience is asking that what kind of a hairbrush is good for what kind, like my hair is curly, and what kind of a hairbrush is suitable for me? That
Wide tooth hair comb should definitely be encouraged as far as hair health is concerned. Sometimes these bamboo combs are also encouraged by many of these uh, many people, but I don't know how relevant that is. That may be environment friendly and everything, but in hair health, I don't think it makes much of a difference. So key here is if you have curly hair, your hair is more susceptible to get entangled. So anything which can prevent that should be encouraged. So wide tooth comb is something that you should look forward to, and try and moisturize it, try and hydrate it as much as possible with your hair mask, with your hair conditioners, with your hair serums.
okay. Another interesting question from our audience is, Doctor, hair spa can grow my hair back?
No, it's a straightforward no. I don't want to add anything to that.
Okay. Okay, now the question is, doctor, you said heat treatment should be avoided, but I have gone through a heat treatment called smoothing, and when I did that, my hair was very nice, and after 6 months I'm facing a severe hair problem. Can it be reversed?
Not really. It cannot be reversed, but yes, a healthy, balanced lifestyle ahead can definitely play a role in healthier hair forward from now. So whatever you've done is something that you've done to the shaft of your hair. Your root can still be something that you can look after. So as far as the shaft is concerned, keep it hydrated, moisturized, nourished as much as possible. But as far as your scalp and new hair regrowth is concerned, all these factors that we've spoken about, your hormonal imbalance, your stress factors, your balanced diet and lifestyle, all these factors are something that you can definitely take care of, and which will result in healthier hair.
Okay, I'll quickly take the last question because we are running out of time. So, from our audience, I'll take the last question. This is a father. He's saying that my daughter is 12 years old and she go to school, but she's having a white hair. So, why she have a white hair? She's just a 12 years old daughter. So, what can I do to get her black hair back?
Okay. So it is nothing to worry as such if it's just one hair. Sometimes it can happen early as well. And what you should look at is the healthy lifestyle that she should have, the nutritional support that she should have is very, very important, because there are nutrients, if deficit, can result in your gray hair. And definitely one should get it evaluated if something else is missing here.
Okay. Okay. So thank you so
Worry about. You should see your doctor once, and once everything else is ruled out. Yeah.
Okay.
That's just about it. Yeah.
Thank you, doctor. This discussion was very informative, and I'm sure our viewers would be benefited by it. So, doctor, would you like to give some take-home message or any other suggestion to our viewers today?
My take-home message is only that consistency is the key. Follow lifestyle and hair health pattern that suits you, that suits your hair type, and do it on a regular basis, like you breathe daily, is how you go ahead with your hair health as well.
Okay. Thank you so much, doctor. Our viewer from some China is also saying "Ni hao, doctor." Okay. Thank you, doctor, for sharing so much of
Sorry,
information. I think some
I did not get the...
I think some audience are also connected from China, and they have said "Ni hao," which means "Hello, doctor." Yeah.
Hi. I did not know that. Hi to you as well.
Yeah. So thank you, doctor, for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. I'm sure our audience have found this session very helpful. And thank you, doctor. It was a delight to have you, and thank you for your valuable time.
Thank you so much. Thank you so much for having me.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today.